Well, we wrap up the week's COVID-19 news here with Dr. Ross Goldberg this morning, the president of the Arizona Medical Association and District Medical Group Vice Chair of Surgery at Valley Wise Health. I like to get all of that in, Dr. Goldberg, because you deserve it, and you're a very wise man. We so appreciate your time this morning. Give us your thoughts on this week, what it's been like. We have seen a dramatic rise in cases in the last, 4 or 5 days or so.
Well, good morning. It's always a pleasure to be on. Yeah, there is a concern. Numbers are going up, but hospitalizations are going up. Percent positivity is going up. These are all warning signs. I've tried to come on every week and be very straightforward and kind of have a realistic view of things. I will tell you right now, there's concern. And I really want to make sure everyone understands how important it is that we all work together to try to stop another surge from occurring. Resources are scarce across the country. So if God forbid we had another surge, I don't know what's out there that could help us. And so we really want to make sure this doesn't happen again. So I really implore everyone to be safe and to follow these rules we've been asking everyone to follow so that we don't have a large spike in numbers like we're starting to see.
So what are the state of the hospitals right now? When we were in the peak of COVID in the middle of summer, we saw that some hospitals had opened additional floors to compensate and help with, more room for COVID-19 patients. Are we seeing any of that yet? Are we seeing any strain on hospitals right now?
I've not seen that yet, but of course, we already learned how that happened before, and we're seeing it in other states. So again, last time, if you looked how this worked, we actually were a little delayed compared to
Right.
other parts of the country. We seem to be in that same kind of
Okay.
pattern again. So hopefully we can stem the tide and not have to do that again. But again, it all requires all of us to kind of follow what the rules are to keep the virus under control.
I think there was some concern with Halloween last weekend. There were people that ventured out who did participate in the holiday, and that was a concern that Dr. Kara Christ and the governor shared last Thursday, and said, please, stay in your homes, do not celebrate the Halloween holiday. Do you think that has contributed to some of these numbers we're seeing this week?
We worry about that, right? Anytime you have large groups of people coming together without masks, and I know there may be different types of masks they were wearing for Halloween, but not the ones we're talking about. There's always a risk, and that's why we have to be vigilant of this. I know it's tiring. It's months of this. We all want this to end. I keep on
Yes.
reminding people that healthcare workers, we really want this to end. Trust me, we're the ones who are seeing all of this. So we're asking everyone's help to try to slow things down. The virus doesn't care. It just keeps on going. So if there's opportunity, it will spread. We have to take away that opportunity, and for right now have a new normal until we can get things under control.
Dr. Goldberg, I'm glad you brought up the idea of pandemic fatigue, because this has been something I think that a lot of people have been discussing all around the country and, in fact, the world. What do you tell your patients when they come to you and they say, I am exhausted of this. I'm tired of being in my home. This is hard on me mentally. It's hard on me emotionally. What can I do?
Right. It's a fair question. Now, we're fortunate here in this state is that our weather, as you were just talking about, is nice. Yes, maybe you don't want to go out in the rain, but it's nice enough where you can go outside. We have that opportunity. So there's an
Yes.
ability here to kind of get out of your home, still stay away from others, but still enjoy outside activities, which can hopefully help refresh things. I mean, we all remember growing up, going outside and playing. It's kind of the same concept. It's a refresh button. I would really encourage people to do that so they can kind of maintain a good mental attitude towards everything, because it can be very tiring. I get it. I don't travel outside much. I go from here to the hospital, and that's pretty much it. I'd like to do
Mhm.
more, but we have to really maintain ourselves until we have things under control.
So I've been mountain biking and hiking a whole lot in the last few months. So I'm glad you approve of that and give us a thumbs up, because that's my saving grace these last several months. Just one more thing, if I could ask you, what can you share with us about your thoughts as we move into the holiday season and how we should be celebrating Thanksgiving and Christmas and safely?
Very carefully. Again, we all have our small
Mhm.
group of people we've been around. I understand that. You just have to be careful of large gatherings. I know that my family's doing a Zoom Thanksgiving from across the state since we can't be together. You have to be mindful about this. It is new normal right now. It is hopefully not the new change forever, but for this year, as with everything else, we've had to do things a little bit differently. So it's the same concept of you don't want to introduce new people that you haven't seen in a while. and expose them. So, and you don't want to be exposed yourself. So it's really the mask wearing, the distancing, just being creative this year when it comes to these larger gatherings is what we're going to need to do, at least for 2020.
All right, Dr. Russ Goldberg, thank you so much for your time this morning. Have a great weekend. We'll talk to you next week.
You as well.